It's Stephanie Cudjoe with Bloom Med here in McKinney, Texas, and it is open enrollment season. So I wanted to run some numbers with you, some just potential numbers, not real numbers, but run some numbers to see how to kind of explain what these different terms are with insurance, selecting insurance. How do I know which one is right for me and my family versus some of the other options that we offer here at Bloom Med for paying for your services. So we have not only our a la carte cash option, but we also have a la carte where you use your insurance, or you can do a membership option through our DPC wing of the practice. So how do we know which one is going to be best for us? Well, it's one of the factors that might help you make that decision is just how often am I going to see Dr. Cudjoe or Alexis or come in for nurse visits? How often do I need to essentially have touch points with the office? And if you're going to have appointments pretty frequently, if you have chronic medical conditions where you're being seen at least every quarter, if not sooner, because we're trying to get these conditions under better control and you need a little bit more frequency of those visits, then that may be an option, a better option for membership. If you want to make sure that you are able to get in same day or next day, membership would definitely be an option because we want to save some slots for our patients that are paying monthly. We want to make sure that you have that enhanced access. But also, sometimes it just comes down to dollars and cents. So I wanted to kind of go through some of the basic terms that you will see when you are looking into different insurance products and how that kind of adds up pretty quickly. All right, so one of the first things that insurance will have you responsible for is a deductible. Okay. And what a deductible is essentially you are telling the insurance that before they pay for any services besides that included physical, you are going to pay a certain amount. And that the average deductible in the US is $2,004. This is not per family, this is per individual employee. So we're going to use that number, okay? The next thing that you will see is called a premium. Okay, and a premium is how much you're going to pay for this insurance or how much comes out of your check to pay for the insurance product that you're selecting. And the average for that in Texas, as of last year, was $424 a month. Okay, so just between these two things, before insurance starts to contribute to your medical costs, you're going to have $2,004 that you need to pay out of your pocket, as well as $424 a month for 12 months for the year. And that total for the year would be, let's get our calculator out here. $7,092 per year. And that's basic insurance. That's not including any co-pays, co-insurances, use of health spending accounts, health savings accounts, things of that nature. So we're using just basic numbers here based off of the local and national averages. So $7,092 gets you your free physical. Did I say that right? I said that right. Yes, $7,092 gets you your free physical. Okay. Or you could choose our a la carte option where you just pay as you go, and an average visit should be about $150 per visit. But with, say, you need a strep test, you need an EKG, spirometry, things of that nature, run you probably about $225, $250. Okay, so even if you came in, say, and you got your physical, which is another, say, $150, that would probably come out for the full year. Say you come in 6 times. You come in 6 other times besides your physical. You have spent, for an a la carte version, because you really don't need to come in all the time, 6 times a year plus a physical would probably run you right around $1,650 through BlueMed. That's not including your lab work. Lab work, let's add on an extra, let's say $350 for the year. That's $2,000. And you've gone to see Dr. Cudjoe 7 times and had lab work done. That's a la carte because you're pretty healthy, right? Every now and then you get sick. You might get strep, you might get flu. You may have some well-controlled blood pressure. You come in twice a year for that, things of the nature, okay? If you come in more frequently, let's say, you know what, I want to use that membership because I have some things that I want to get taken care of, and I really want to, I'm ready, I'm highly motivated to take care of it. I want to work with my doctor in their office to get healthy. Then you can choose our membership option. Remember, this also comes with some additional benefits like discounts on our supplements, next day and same day appointments, after hours, cases, where we address cases after hours, just lots and lots of extra benefits. Then we can choose membership, and our membership is $140 a month, or for the year is $1,680. So when people say, why should I choose membership? It comes down to your pocket. What could you do with an extra $5,000 between here and here? Christmas gifts, trip. You could take that extra money and use it for your specialist visits. You could find a lower deductible plan, a higher deductible plan with a lower premium, pair it with your membership and still come out saving money. There's lots of ways now that you can advocate for yourself and get the health care that you need at a better price point than what a lot of traditional insurances are able to offer or your employer is able to offer. It's very rare, especially in North Texas, to find the same combination of a low deductible and a low premium. So if you are in that boat and you have that wonderful insurance product, that is wonderful, amazing, please use it. And you can use that here. But for the far majority of our patients that have insurances, they are dealing with numbers like these, and they are choosing to actually pay for their primary care services with us through membership because they would be able to see us multiple times a month if they wanted to and still not even meet their deductible being spent. So hope this helps. If you have some questions, you're not sure how to pair a direct primary care membership with an insurance product, we do have some wonderful resources that we can point you in their direction and they can help you. If you're not quite sure still and you just want to give us a call, please do so. We'd love to talk to you about how you can get in and see us here at BlueMed. Have a great day. Bye.